So hello and welcome to my YouTube channel, Nursing with Koi. My name is Wangoi Mwangi and I'm Kenyan RN. I do videos on nurse education, patient teaching, as well as health education. And this video is about nurse education because I will be talking about the 6C's of nursing. And these are set values that were set in 2012 in England. By their chief nursing officer that had to demonstrate nurses had to have compassionate care, and there are 6 values all starting with the letter C. So we are going to be seeing what are the 6 C's of nursing and why are they important. So if this is your first time here, please consider subscribing to this channel and hitting the bell icon so that you're notified every time I upload an informative video. And if you're a returning subscriber, know that I deeply appreciate you. So this is C stand for 1, care, 2, compassion, 3, communication, 4, courage, 5, competence, and 6, commitment. So they should be at the top of your practice as a nurse, especially if you're practicing your registered nursing or whatever kind of nursing in the UK. And a few years later, after it was adopted for nurses, it was again adopted to expand the horizon to cover all health workers as well as social caregivers or social caregiver staff. So yes, these are very important concepts, and for as long as you have this at the back of your mind, then you're good to go and you're able to practice. They are applicable anywhere in the world for as long as you practice nursing each day. It doesn't matter whether you're in the UK or not, so they are quite important, and if possible, adapt them where you can. So the 6 C's are a set of values for all nurses, healthcare workers, and social care staff, and this is in the UK because again this was a part of a document that was adopted in 2012 by the chief nursing officer of that time, and her name was Professor Jane Cummings. So these 6 C's I has explained earlier. We have the 6 of them, and the first one is care, second one is compassion, third is competence, fourth is communication, fifth is courage, and sixth is commitment. When it comes to care, or the first competence, is about maintaining our core business as nurses and those of the organization where we work, and delivering care that helps the individual patient improve their health and the whole community as well. Caring defines nurses and our work as nurses. People perceiving or receiving care expect it to be right for them, consistent throughout every stage of their life. For example, patient will not know that you have more than ideal number of patients. Let's say in a shift, let's say you find instead of the usual 1:6, you find yourself with 1:30. The 30 patients will still be expecting the same level of care no matter how stretched you are. But again, we do the best we can with whatever resources we are availed and with whatever time we got. The second C is about compassion, and compassion is how care is given and the relationship, or the nurse-patient relationship. How is it based on empathy? Is it based on respect, or is it based on dignity? So it has to be based on empathy, respect, and dignity, and it can also be described as intelligent kindness, and it's central to how people perceive their care. You may do all your best and finish your chores as nurses or your duties for that patient, but if they did not perceive like you took care of them with this compassion, they might even underrate the care you gave them, because probably they did not see you conveying compassion during your care as well. So then we have competency as the third C, and competence is necessary to update. It is necessary you as a nurse to keep updating yourself, to keep yourself updated, because the nursing field keeps changing. The medical knowledge will keep shifting. There will be updates almost every single day, and therefore it is important for you as a nurse to know what is new and to know your limit while working as a nurse. So if you do not have a certain competence, do not attempt that procedure. Just do what you feel competent and you're confident in carrying out, because there is nowhere you're going to explain yourself and say, if let's say a litigation suit comes, you will not be able to explain and say, I did not know how to do this procedure, so I did it how I thought it should be done. You always, before you do any procedure, you must feel competent enough and confident enough that you know what you're doing. So because in the event that the patient is hurt in the process of care and Repercussions will therefore follow. You can be sued, you can be fired, you can have both, but most importantly, be competent and only do those things you feel confident and competent about. Then it is important that all workers or all nurses gain competence, and it is evidenced by compliance the requirements that have been set by the regulatory body, that is the Nursing Council of Kenya. It is also important to keep updated with staff evaluations, feedback, and training. So you will find that most institutions here in Kenya nowadays, there is something called performance appraisal, and it happens even for nurses. And when your performance is appraised, they are able to tell you areas you could improve on, and you're able to see the room you have for improvement. Then it is also important to give feedback. For example, you have done a training and you passed, or you graduated through that training. You can give feedback to your fellow nurses or to your colleagues so that they're able to implement the things that were useful in that training in the workplace. Training is also very important, and you'll find most workplaces nowadays, they have different trainings organized for their staffs on their dime, and therefore if you're asked by your hospital or your employer to go for a training, then the answer should always be yes, because again, you want to gain competencies at all times. Then this is done to maintain the highest standard of care for each patient. Number 4 is communication, and communication is essential in nursing and in healthcare in general. It is central to successful caring relationships and effective teamwork. Remember, as a nurse, you will be the go-to person for all the other people working within the hospital setup, or if in any other setting. You will be talking to people all day. You'll be communicating with different people for different reasons. And for the patient, remember, it is a nurse-patient relationship, which is a therapeutic relationship or a healing relationship. So this is a caring relationship and should exist for as long as that is the patient, or you are taking care of that patient for that shift or that day or that period. And then teamwork, again, you can't be an effective nurse without teamwork, because sometimes some days will be so crazy that you will need the person next to you. Most of our procedures, again, will require teamwork. You will require to be 2 of you or 3 of you. But again, remember, communication is what we are talking about. Another thing is about listening. And you will find most places where there is caregiving and care receiving, there is always something about the listening. Because sometimes the most urgent thing a patient may require you to do as a nurse probably is not the most emergent thing you may think of medically, but it is what they want. You may find a patient wanting to have their phone to call back home, and they have just come from theater. Probably their phone had been kept somewhere, but they keep insisting, before you even take observations, give me my phone, I need to communicate. But at that point, you need to have done all, you need to observe him, you need to do all those other things that you need to do. But whatever the patient is talking about and whatever they are voicing out and verbalizing, it is important for you to listen and actually infect it and consider it while providing that care. It is also important to keep clear records. There are so many records that nurses keep. The most important one being the nurses' codex, the nursing care plans, and the planning for fluids and nutrition support. Some of these documents can be used in a court of law, either to exonerate you or to actually fix you in a negligence claim or error of commission claim. So whatever it is that you do, be as detailed and as concise as possible. You do not have to write 10 pages of stories. You just need to have all the details in a very short way, so that you're able to do that in a very shorthand manner, because it's not like you have all day to codex or all day to do all these things. We are usually writing so fast and moving so fast because nursing is a very fast-paced profession, and you have to keep thinking on your feet, as well as documenting the care that you have given, because that is the only evidence you will have. Another thing, it's important to document or to keep proper records. Is important to own your documentation, because whether you are permanent staff or temporary staff, you are an important part of that community. And if there are questions to be raised later, it is important that it is raised to the right person, or the person who was during that shift when the complaint came. Then courage is number 5, and this is very, very important. It is so saddening to see very apprehensive people, very timid people, people who cannot voice up about things in their workplace or as nurses. because courage enables nurses to do the right thing for the people they care for, and these are the patients. So your patient is primary focus. Patient focus is your primary concern when you're at work. So if there are concerns regarding patient care and this patient focus is your main goal for being at work that day, then it is important to have that personal strength and vision to innovate and to embrace new ways of working. It doesn't have to be because you're just doing your first day there, you have to go with the status quo and the norm. If there's something scientific behind the rationale about something and you think change would have been better than the status quo, it is important to have that personal strength to voice that out, because that is how change happens, and change is always for the better most of the time. And especially if it's about patient care, it should always, and it's about improving the quality, again you have to just speak up. And sometimes nobody is against you speaking up because they also want the same. The goal for the nurses are usually the same for the doctors and the same for, because all we are here for is for the patient, to provide good health care, to build a healthcare system that is strong enough that our people are healed and feel cared for and they receive good quality care. So the courage to speak out when you think something is going wrong, or you see someone making a mistake, or you think an error has been made, even if you make that error yourself, again, you need to have the courage to actually report that error. Because, for example, God forbid you make a medication error, and that medication is lethal and kills the patient. Even if nobody saw you and nobody will ask and question your caregiving skills or your medication that you had given to this patient, at the end of the day, you will be thinking, could my medication have caused that death? Probably it may have caused the death, but probably not. But the whole idea of having that at the back of your mind and that scared, it will bug you, it will depress you, it is going to just waste a lot of people's time and your time most of the time. So to avoid all that sorrow and grief, just communicate, have the personal strength to say an error has been made, this has occurred, and if it has occurred, do we have an antidote? For example, it's for the example I gave about the medication. Again, most medications, if given in excess or the wrong dosage or the wrong medication, they will have something to reverse, or they have something that can be done to alleviate the symptoms or to make the patient feel better. Sometimes you may need to give maybe an IV fluid to flush out the toxins or to just observe the patient. Whatever it is that needs to be done, you just do it because you had the courage to own up. Owning up is very dangerous and not many people would want to do it. But when it comes to patient care, the main focus or the main goal why you trained as a nurse is because of patients. You do not choose your patients. It may be a murderer, it may be anybody, it could be a prisoner. It really doesn't matter who the patient is, but that patient is your primary goal, to see them happy, to see them cared for, to see them healing, because they have come with their illness or they have come presenting with whatever symptoms they have come, and you are there and you are charged with the mandate to take care of them. So remember, all these 6 C's are coming up and aggregating to the same point of compassionate care. So we do give care, but the care has to be compassionate. So the last C is about commitment. Our is commitment. Commitment to our patients as nurses and population is the cornerstone of the nursing profession. It is what we do. It is what we are mandated to do. It is what we are tasked to do, and we are held to that account. There is a lot of accountability that has to be taken care of and into when you're practicing as a nurse, whatever level you are. If you are just a novice nurse, a student nurse, or you are a seasoned nurse, you have experience over 20 years, you have experience over 50 years, you still are a nurse, and it's our profession. And commitment is to the patient of the day or the population you are assigned to. So we need to build our commitment to improve the care and experience of our patients, even without being told by anybody else. It should come as self-driven purpose to commit to your patient, because they are the primary reason why you came to that hospital or facility. Your job is not just working in the hospital, it's actually about each and every patient, and most importantly, tailoring each patient's care to their own needs. Listen to them, listen to the care plan. As you're doing the care plans, it's very, very important to have individualized care plan, because what is good for me may not be good for you, and what is good for you may not be good for your neighbor. And if all of us are patients, we could be having the same medical condition with the same treatment, but we could be requiring different things at that point in time. So we need to take action to make this vision and strategy a reality for all and meet the health and social care challenges ahead of us. So nursing is usually a challenging and busy profession, but again, we are committed to care. We dare to care, we dare to listen, and we listen to care. And because we care, we listen, and because we are committed, we offer compassionate care. So there are certain characteristics that are most commonly associated with compassion regarding to caring and nursing, and these include being sensitive or sensitivity, having empathy, kindness, being a person-centered approach or client-centered approach. This client is different from the other client. Therefore, their approach may differ, but do what works for that patient. Then the relationship involvement, that means the nurse-patient relationship, the therapeutic relationship should be nurtured. And it's not only with the patient, but also with their caregivers, because some of the patients, especially for me, as I've said in my videos all along, I said I'm an oncology nurse. So I deal with patients sometimes who have gone through so much and they know so much about their treatment that sometimes they'll tell you, no, today I'm not due for that drug, I'm due for this, and I don't do this, I do this. So you tailor them, you work with them, and also you work with their caregivers, because chances are that because they are of their chronic nature of the illness, they have been walking that journey with someone, and we always encourage someone to have a support system. So have a good relationship with those patients and their primary caregivers at home, especially the people who have brought them to the hospital at that point in time. Then empowerment. Empowerment is key. Empower yourself, empower your colleagues, empower your patients. And when it comes to empowering patients, it has to do with patient teaching. Patient teaching is so important because there is, I don't know whether it actually did happen, but there's something I found online during my cruising through nursing studies online, and this was about patient teaching. And then there's this doctor who was saying that his patient, an asthmatic patient who was on inhalers, had not been improving for a certain period of time. And every time he comes, he's always in status asthmatica, so they treat him and then he goes home. So when he's in the hospital, he is doing fine because someone is helping him administer those medications. But when he goes home, instead of using the inhaler to inhale through the nose, he was spraying like the way you do colognes on the neck. So he just do a small. So when he's asked, did you do 2 puffs today? Yes. Where did you do that? Now that day, the doctor asked him where he did the puffs, and then he's like, just right over here where I usually do them. So then, anyway, it was just about, I don't think that really happened, but if it did, you can imagine how much patient teaching would have saved for that patient, because they had to come to hospital severally because they were using their inhaler wrong. So sometimes it's about patient teaching, sometimes it's about empowering them, sometimes they're just sad, sometimes they just want someone to speak to, sometimes it's about your colleague. You uplift one another because you are in this journey together. If there is something they are doing and you think they are not doing it within the right way, it is very, very important to correct them, and correct them again very gently and firmly, because the point has to come across. But you do not have to be rude, you do not have to be harsh, you do not have to finger point or blame or even shamify them. Just tell them kindly and then teach them if you can, or let somebody who can teach them teach them. Then we have understanding how people are feeling, very important for nurses. And this also has something to do with being non-judgmental. Sometimes people can be very judgy, and you will see something happening and then you see something and you judge, and that affects or gives you a bias. So again, be non-judgmental. Listen, respond, and be responsible. Very important. And the final role, or that attributes to this compassion care, the final attribute is advocacy. Advocacy is just about standing up for somebody and trying to speak if you think it needs to be spoken about. If something is not happening the way it should, then you stand up and you say 1, 2, 3. Or you seek clarification, or you seek someone to actually educate you in the processes. Because this advocacy, you're always the patient's advocate. You have the patient best interest at heart. If someone is doing a wrong thing to the patient, again, you stand up, you speak out. If you have to report it, then you do report again. So the importance of the 6 C's in nursing, they have been set out as values and standards for nurses to work towards, and they are trying to help us improve the quality of care we give to our patients. So the purpose of the 6 C's was to ensure patients were looked after with care, compassion, by professionals who are competent, who are able to communicate well, and have the courage to make changes that improve care and can deliver the best and commit to delivering this all day, every day, all the year round. So there should be not many excuses when it comes to the quality of care, because we are committed to do this, and we are committed and we are going to sustain the behavior of always delivering the best quality care we can. They represent an attempt to ensure all patients receive high quality care. I know when we say all patients, sometimes the patients who seem stable sometimes feel like we are favoring the ones who are very sick, or the ones who are, the one who require total assistance with their activities of daily living. They will take a little bit more of your time, but even your very stable patients should also feel taken care of, and that the care is high quality. Personally, I would argue that communication is perhaps the most important principle, because it can break or make your profession as a nurse. So it is important to learn how to communicate in different ways, because you will be required to page people, you'll be required to call people, you'll be required to respond, you will be shouted at, you'll be yelled at, people will not be very kind to you. But at the end of the day, it is the grind, and sometimes the grind is really hot towards the end, but you have to really keep your calm and learn how to communicate. Sometimes if the communication is just getting in a different direction, again, remember, you do not have to argue with every single bad person you have to encounter. You can just take a breather and then come back when you're better composed. Then the patient experience, according to a study that was done, has been recognized as an indicator for the quality of care delivered. And this is by Darcy, that was done in 2008. So, and communication is a major aspect in the patient experience. And there is always this thing that we are always told, that sometimes in a private hospital, like the way in Kenya, we had this, there was something in the news about the turnaround time for different hospitals. And these reporters, or whoever, those people who are investigating, the person who were doing the investigations, they were going, queuing like normal people in the emergency department or in the outpatient department, and recording how much time it took from the time they registered themselves and to the time they saw the doctor and received all the treatment. And if they went to the lab, what was the waiting time and what was the turnaround time. So if you remember, most public hospitals performed really poorly compared to private hospitals. However, if you looked at those timelines, even the private hospitals and the very good private hospitals were registering very long hours as well, from the period the patient registered or arrived at that point and when they were seen by the doctor. But probably that patient did not complain, because most of the time they will keep telling you, now we have logged you in, now we are doing this, now we are doing this. But the patient is still waiting. But the only thing they're receiving is that verbal affirmation, that, the recognition that I remember you are there. So, which may be elusive in a public setup, because probably the person to even come tell you that is the person who you are supposed to see while inside. So instead of them wasting valuable time to come tell you something, they choose to do something different. That is not an excuse, however. The point is always maximize on the patient experience, because it's because of this patient experience that we acquire nursing excellence. So for this presentation, these were the references that I used. Again, you will notice that most of them are UK-based references, but the internet is forever and it is global. I do love most things about UK, UK policies, especially when it comes to healthcare. And the 6 C's is just a brilliant policy or set of values. And the way they have communicated them, they make sure they are very clear. The clarity in their policies, in their documentation, is just, it makes you understand care or nursing care in a different light. Thank you so much for watching, and bye.